Good morning, good afternoon, good evening, everyone, depending on your location. On behalf of the Boost and Ariadne Labs teams, we'd like to welcome you all to the first official live session on Global Mass Vaccination Site Collaborative. Today's session is focused on mass vaccination site setup and implementation. So before we get started, just have a few housekeeping items that we'd like to go over. So be sure to mute yourself when you're not speaking. We ask that you do this to limit any background noise, especially when the speakers are presenting. You can also use the raise hand feature that we have if you have a question or a comment, but I do encourage you to use the chat box to submit your questions or your comments or to respond to other participants throughout the session. And if you haven't already, now would be a great time to introduce yourself and where you're joining us from. I see that a few of you have already started doing that. Thank you. Great. So for those who may not be very familiar with the Boost community, welcome. Thank you for joining us again. This community is a diverse and growing network of over almost 2,000 immunization staff from 133 countries. So through our online platform, boostcommunity.org, we offer opportunities for our community to connect with peers, strengthen their leadership and advocacy skills, and grow in their careers. And with that, I'd like to introduce our partners from Ariadne Labs, who will share a little bit more about their organization.
Thanks, Yvonne. Hi, I'm Eric Gorelnik, an associate faculty member at Ariadne Labs. And we're really excited to partner with Boost with support from the Bill and Melinda Gates Foundation to launch this Global Mass Vaccination Site Collaborative. Ariadne is focused on scaling and implementation of public health and medical innovation across the globe. And we've really been laser focused on vaccine delivery and have built up a program over the last 6 months around sharing lessons learned on mass vaccination sites, and are excited about today's beginning of our journey. So thanks, Yvonne.
Great. Okay, so now we just want to share a little bit more about this global mass vaccination site community of practice that we're developing. So it's a community of practice and it's a collaborative aimed at providing resources, accessible tools, and experts available to assist vaccination site operations in low and middle income countries. So this collaborative will feature curated events, a learning group, which is now live on the Boost community platform, and an open access website, which we're planning to launch early January, where you can access several resources, tools, conversations, and events relating to mass vaccination rollouts. If you recall, several of you may have received an invite via email to fill out a survey. This was last month. And this survey was really to understand the current state of mass vaccination site operations within your country. So as a follow-up to that, we developed a follow-on survey ongoing with more specific questions around mass vaccination site operations. So I do encourage you all to fill out the survey because your feedback is very important and will kind of help inform the sort of resources and tools that we develop to ensure that, you know, it's as relevant and useful for the community. Anything else you wanted to add to that, Eric?
No, thanks so much, Yvonne. You know, we're focused on getting needles in arms. With Omicron, it's becoming a bit more complex and we can expect more variants in the future. So we need your help, and we're here 100% to support you on teaming, collaborating, getting information and learning from each other. So we're really excited about this partnership, and we are here to support you in your efforts. So fill out the survey, get us some intel, and we're working for you. Back to you, Yvonne.
Great. Okay, and now just want to quickly introduce our presenters and our moderator for today's discussion. First, we have Vidya Sempath. She's the director and global team lead, data analytics at Village Reach. We also have Freddie Nkosi, who is the DRC country director at global Village Reach, rather, and Carla Toko, who's the manager of advocacy and communications at Village Reach. And last but not least, we have Hyacinth Moshimbamwiza, who's the Rwanda country representative for Clinton Health Access Initiative. And with that, I will hand it over to you, Vidya. Thank you.
Thanks, Yvonne. Thanks, Eric. Can you both hear me? Great. Thanks, Eric. So welcome, everyone. Really excited to be here today and to learn and share with you all. Let's first start with some level setting in terms of what do we mean by a mass vaccination site. Now, in order to vaccinate hundreds of millions of people in a 2-year time frame, countries will need to have multiple vaccine delivery mechanisms or access points. It's going to need a mix of options operating together, some for a short time, some for a longer timeline, in order to actually do this within a limited time span and not have this take years and years and years. So some of the options that countries have are using their fixed post health facilities, outreach vans, mobile teams, temporary vaccination tents, and also high volume or mass volume vaccination sites. Now, what constitutes a mass vaccination site really depends on the country and the local context. For one country, a mass vaccination could be 500 people a day going through a site, and for another country, it's more like 5,000 people going through a site. And what we're really looking for in terms of the common thread between these sites is that they're set up at places that are easy to access. So they're usually sporting venues or sporting grounds that a lot of people can come to in cities or small towns. They could be large parking lots, hospitals, or university campuses. These are just some examples. And they're really large enough to accommodate more than 100 people in an hour while still maintaining some of those physical distancing precautions, and also being able to set up post-vaccine observation areas where you can monitor many people at once. So that's what we mean by a mass vaccination site as far as today's conversation goes. Next slide, please. So we have a couple of polls to run with the audience today before we hand off to our presenters. So the first poll question that we'll be pushing out is, does your country currently have a mass vaccination site set up for your COVID-19 vaccine rollout? So based on the definition and the level setting that I just provided, do you think your country has something that meets this type of criteria? And you'll see the poll option come up as a Zoom window.
We seem to be having some issues launching the poll. Can everyone see?
Popped up on my end.
Oh, great, perfect.
Yeah. Okay, I think that's sufficient time. Hopefully everyone has been able to respond. If you don't see the pop-up box, you can also respond via the chat. Next poll question, please. Okay, so the second poll question should have popped up as another box as well. So this question is, in your experience, what has been the most challenging aspect of setting up and implementing a mass vaccination site in your country? So you can choose one option. Okay, and then Yvonne, will we share the poll results as part of the meeting readout?
Yes, Jenna, if you could launch the results, that would be great. Thank you.
Okay, so for the second question, which is what has been the single most challenging aspect, the majority of responses overwhelmingly was around community engagement. So feeling like if you try and set up a mass vaccine site, will people come? So vaccine acceptance and demand. And then the next one was staffing shortages at about 19%, and then lack of stakeholder buy-in at 15%. And then poll question number 1. Overwhelming numbers of countries represented on this call do have mass vaccination sites set up, so that's great. It shows that there is a real community here that can share lessons and best practices as well as challenges with one another, and we can have a real peer group and community of people working on this issue together, so that's great. Okay. So now we will hear from our presenters. The first set of presenters are my colleagues at Village Reach, representing the mass vaccination site that very recently launched just about 2 weeks in the city of Kinshasa, which is home to about 16 million people in the Democratic Republic of Congo. Next slide, please. So before I hand off to my colleagues, Freddie and Carla, I'm just going to give you a very quick overview of a project that Village Reach has that has just gotten off the ground, which is to support high throughput COVID-19 vaccinations in Africa. We first intend to launch a couple of sites in Kinshasa, which is the one we'll hear about, and then a second site in Abidjan, in Côte d'Ivoire, which we hope will be open soon. And the goal at both of these sites is to be able to vaccinate about 1,000 people. And as we get going, we want to be able to document all the ways in which we were able to be flexible and nimble while responding to both supply and demand challenges, staffing shortages, and any type of new roadblock that this pandemic seems to continue to throw our way. And we'll also be conducting some studies, both a costing study as well as operational research type study that will inform what are some of the best practices to run vaccination sites, not just as it pertains to COVID-19, but in general, adding to the information and the knowledge base around running large vaccination sites in low and middle income country settings. We really want to share real-time lessons. We don't want to wait 6 months or 1 year after the project ends to then do an analysis and to then share with external partners and peers. So this webinar is an example where we're only 2 weeks in, we have a long way to go, but we want to learn from even just the last couple of weeks and the weeks leading up to the launch. So we want to learn from it, reflect on it, and then share it out in real time. So this is an example of the ways in which we want to do that. We'll continue to disseminate and amplify everything that we learn through various mechanisms, such as these Boost and Ariadne managed webinars and websites that they will have on this particular topic. And in the end, we do hope to publish so that this becomes part of the long-term knowledge base on this topic. So with that, I will hand off to my colleagues from DRC, Freddie and Carla. Over to you.
Yes, thank you, Vidya. And as Vidya said, this is really an ongoing process, and we're still learning a lot from running such a site. So we'll briefly share our short experience in putting it in place, a medium volume site in Kinshasa. Next slide. So just to provide a small context, so DRC has begun to vaccinate against COVID-19 on April 19th of this year. However, our vaccine coverage remains low, estimated at less than 1%. But according to a fairly recent survey, mainly from UNICEF View reports, it's shown that at least among the 44% of people who are willing to be vaccinated, about 12% of them didn't know where to get vaccinated or thought the vaccination site was too far. So in seeking to support the country's NDVP for COVID-19, Village Reach really wanted to draw from its strengths in DRC to bring health products to people. So hence bringing the COVID-19 vaccine closer to the Kinshasa population by installing a mass vaccination site in a highly frequented public space. So this idea was most welcomed by API officials who are really looking to strengthen COVID-19 vaccination. So as a result, we identified a site with multiple government stakeholders in the Gombe district, which is at the central district of Kinshasa in a space called Place des Évolués. And it's a place surrounded by multiple bus stops, government institutions, several office buildings, embassies, and so forth. And the provincial minister of health that you see pictured, actually, she officially launched the site about 2 weeks ago in Kinshasa during a ceremony that also marked the beginning of the COVID-19 mass vaccination campaign in Kinshasa. So to run this vaccination site, there are more than 30 staff working from retailers, clinicians, vaccinators, as well as community health workers who are supporting interpersonal communication with people in the surrounding areas in order to refer and orient anyone willing to get vaccinated to this specific site. And there are three types of vaccines that are offered: Pfizer, Moderna, and the Johnson & Johnson vaccine. Next slide, please. So, so in the next few slides, we just wanted to show that installing this site was a process. So since we couldn't find a particular building where to house this vaccination site, we had to create something in a space provided. And it took us about six days to construct the current site in place. Next slide. So, so the next couple of slides will be really showing what the site looks like. So since the launch ceremony, we've really tried to improve the site in order to add some homely touch. As you see, you know, we've added grass inside. We've put even couches for the observation area so that people will feel really comfortable coming to get the vaccine. We provide water, even juice, just to make people really comfortable coming to this site. Next slide. Yes, next slide. So I think these are just some pictures of showing people inside the site, in the welcoming area and also in the observation area after vaccination. Thank you. So as of day 17, which was Wednesday, the 15th of this month, we've vaccinated 2,323 people. And as you see from the data, the vaccine that's most administered is the Johnson & Johnson vaccine. But on a daily average, this site currently vaccinates the most people in Kinshasa. And among the vaccinated, more than 80% of them are male. and 80%, over 80% of all vaccinated are people of the age of 55 years and younger. And among the professional categories, you only see a few health workers, which is about 4% of all the people, of all other categories of people being vaccinated. And so for the next slides, I'll turn it over to Freddie to present challenges and lessons learned from the process of installing this site in Kinshasa. Over to you, Freddie.
Thank you, Carla. Yeah, the numbers that Carla presented, if you compare to other places in the world, it seems not a lot, but if you have to put it into the DRC context, this is very significant. In fact, no other vaccination site among the over 200 vaccination sites exist in DRC. None has vaccinated so many people in just 2 weeks. Yeah, this explains why vaccination coverage is so very low in DRC. Carla said at the beginning, less than 1% of the population received the COVID vaccine, but we have to say the structure we established in French, we call it the vaccinodrome or mass vaccination sites, is making a significant impact. This is the reason the EPI and all other government officials now they're advocating to set up more mass vaccination sites, the one that we started 2 weeks ago. So the plan is already unfolding to set up more mass vaccination sites in different places in Kinshasa, which is a very big city. Coming to the challenges, although there is so much positive input coming from the site, but are also challenges related to setting up and also running the mass vaccination site. Among those challenges, we were targeting another location to set up the site, but that location was no longer available, and we were just informed few days that we could not use that location. We need to move to another one. So that forced us to change all the plans we had, even with the service provider, to set up the tent. He had to review all the calculation and so on. But also, we had to try to catch the right wave because the mass vaccination campaign was about to kick off, and the Minister of Health wanted the site to be set up before the kickoff or before the campaign, the 14-day campaign ends. So we had really to work day in and day out, weekdays and weekends to set up the site. That put a lot of pressure on the staff, but also on all the consultants who were hired. And you know, the site is an open place. As Carla was saying, it's not in the building, but in open place, and not far from the Congo River. And 2 days after the launch, the roof was damaged after a heavy rain. And so we headed to call again the service provider to fix the roof, and that's forced us, for example, not to function last Sunday, because they had to change the whole roof to put a solid roof on the site. So those are some of the challenges. And also, you look at the numbers of people vaccinated, you have noticed the majority of people, they are preferring one vaccine, Johnson & Johnson, possibly or because it's a single dose compared to other type of vaccines. Also, we are not yet, although we are making significant impact, but we are not yet meeting our target of reaching over 500 people just at the site per day. And now we are multiplying strategies because we had a national consultation where it came up clearly that there will be people who coming to the site, but there will be people who will not come to the site, and we have to go to all those people. And now we are organizing the mobile strategy to go around the institutions, organizations around the site to provide vaccination services. Just this week, we vaccinated staff from DKT International. We vaccinated staff from UNICEF office. We vaccinated staff from EcoBank, from other government agencies. And next week, we will vaccinate staff at Bolloré, logistic and transport, in 3 different locations. And today we start vaccinating also in the Kinshasa Christmas market. We are already seeing people getting vaccinated in the Kinshasa Christmas market. So we are basically using the site as a hub where people can come, but also as a place where we can send the mobile team to go vaccinate the people who cannot come to the site. Next slide, please. And we are hoping as we multiplying strategies, the number will definitely increase. Some of the lessons learned, we have learned key government stakeholder buy-in is critical. It took us very few days to get all the authorizations because all the government officials involved or related to the vaccinations, they were favorable about the initiative, and it took us very less days to get all the paperwork we need from the government. But also we learn to be very flexible, agile, and resilient. So we are adapting our strategy to accommodate, for example, the people working in the institutions. They found very difficult to go to any vaccination site. So we are going toward those people. So we are reviewing constantly our strategies to ensure that more people are getting vaccinated and are becoming ambassadors for vaccination in their own community. We are also working like increasing the capacity of staff to reduce the waiting time. We are increasing the number of community health workers so that they can bring more people at the site, or they can speak more about the vaccination in general in the community where they are working. And we are also learning that the mobile strategy or the outreach will start bearing already some fruit, as now we are receiving more and more requests from companies. Vodacom, DRC, Orange, DRC, they all made already a request to send the teams to the mobile team to vaccinate the staff in their offices. I think that was the last slide. And over to you, Vidya. Thank you.
Thank you, Freddie, and thank you, Carla, for that overview. As you mentioned, it is early days, but it's really exciting to see what is possible when you're able to catch the right wave, as you said, and when you're willing to be flexible and figure out how can we get the vaccines to the community instead of expecting the community to always find the vaccines on their own. So thank you for that. Yvonne, do we have our third speaker on, or?
We unfortunately do not. Okay, yeah, I think he actually just joined us. I know was held up with a meeting with some government officials. Hyacinth, I'll let you go ahead and take over.
Yeah, thank you, Yvonne, and hi, everyone.
Great.
My name is Yacinthe Shubamiza, and more sharing the experience of how the campaign has been going on in Rwanda. Next slide, please. So right after when the country kicked off with the campaign, so as it was across the country, has to make sure the guidance is clear across the country, and they had to quickly develop these two important documents, an SOP on how to set up a vaccination site, and also the national guideline for COVID-19 vaccination. As different maybe to some of the contests, actually the first day where the campaign started, we have to use the existing facilities. Of course, there were some few temporary sites where the campaign was supposed to take place, and depends on the number of people we were expecting. So that means like in some of the markets, some of the car park where the country has to, but in terms of setup, it has to be the same thing, and that's how we're clearly detailed in these two documents. Next slide, please. This work has been put in place in terms of the setup. So beside of doing the vaccination, but also we know the COVID itself, it's an infectious disease. So I had to make sure we follow the IPC process. So that's how we set up the site from the entry, and then you go to check-in, where you do the data entry for someone who need to take the vaccine, and there will be a set up place where a waiting room with chairs, everyone come and sit while you're waiting to get into a vaccination room. And then after getting your vaccine, so you move into observation room for the 30 minutes waiting time for the observation to see if there's any immediate adverse effect of the vaccine, and then you move. And of course, we'll see that the below part of the chart is that after the checking, and then sometimes when we move to the second phase where people they are coming for the second dose, that's where we'll see this part becoming more effective. People who might come before their due time to the second dose, someone need to verify within the system if they are due to the second dose, and then they can even go back home if their time is not yet there, or if you're coming for the separate antigen, why on that specific site there was a different one. So that's why this part was really specific, to make sure we minimize any source of error that can happen during the vaccination. Next slide, please. So if you look on the core duties that happen at any site, and regardless whether it's a temporary site or a health facility. So by setting up, you make sure you have that reception or check-in list, because the data are entered of the beneficiary right away. So the country is doing the DHS2. That's how we record the people who are receiving vaccine. And that's the same system that generates a reminder when you are due for your second dose. And of course, we have a help desk in case you are not going to receive your vaccine, then you can be helped to know exactly what you need to do next. And of course, we have that waiting room, which is enough, and then you need to know exactly how many people are coming in to know the size of the waiting room you need to get ready. And then also we have the personnel in terms of, for that specific site, the person who need to do registration, and then clinicians in charge of vaccination. At least we have like two teams minimum in talking about the health center. If there are few people, but we have more like 20 or even above sites, like a teaming up to deliver vaccine. And then we have the clinician in charge of observation after vaccination. And then we have also people who are in charge of surveillance for 1 day, 3 days, 7 days, up to 21 days in terms of FI. And then of course we have a team leader who take care of that site, in charge of reporting, and then someone from the central level who make sure the whole thing is going as planned. And then as I mentioned, also we have that core part, which is the data management reporting. So as I mentioned, the country is doing the HMIS as to use the real-time data, and then the data need to be entered right away. And also that's how we check if someone is eligible. As initially we were more looking on who need to be vaccinated, which antigen they are getting, or make sure that data is there rather than relying on someone's information, which is not recorded. And of course, that also helps to make sure that what is happening is really what is in line with the guideline. And then we go to the point of handling the vaccine. So the vaccine, whether you're a temporary site or you're an existing health facility, they take their vaccines either from the central warehouse or the nearest health facility. Then at the end of the day, so if you have a leftover, they can go back to that health facility where you collect the doses. And of course, and all related logistics are handled by that command post for the campaign. And then we have the adverse event section where we need to make sure there's a proper follow-up of our beneficiaries who receive the vaccine. And it's very clearly detailed in the guideline as where the Rwanda Biomedical Center and the Rwanda Food Drug Administration, they are the one who work closely to monitor the IFIs. And as we straight adopted the existing system for IFI for other pharmaceutical products. So that's the same system that is being used in addition to people who can make a call to the hotline for Rwanda Biomedical Center, or even for their clinicians in their catchment area. And of course, during the waiting room, the benefit that clients are communicated to the channel to use to report the IFI to make sure when they go home, they are well informed on what to do during on any event that they need to report. And as more talking about those for the temporal site, in terms of logistics and waste management, as you see to the personnel, there's someone who's team leader. They need to assign someone who go and pick or drop off some of their supplies they need at the facility, at the site during the vaccination. That's the same thing when it comes to waste management, because at the end of the day, you make sure the site are clean and to make sure there's not going to be any harm or any hazard exposure to the site. Also the team leader in charge of reporting every day how many people, even though the data has been uploaded in HMIS, they also need to report the number of doses they have used, number of people have been vaccinated, just like a flash report to the command post. And of course, if there's any wastage, so that need to be communicated on the same day, not waiting, even though we have that data from the HMIS. And then I would say in terms of communication, which is the key here, we know that also with that limited supply, you have to know who's coming. I think it's not good to have someone coming then not getting their vaccine. I think now the country is doing more effort to start the campaign for everyone from the 12 years and above. But before was more make sure someone who's coming, that person who is eligible for the vaccine, it's not good to bring someone on the site and they are not getting their vaccine, but also trying to minimize any of the wrong information coming in to make sure everyone is having the one source of information. So there's a Rwanda Health Communication Center, which is clearly only in charge of that, and all the communication are coming from them. So make sure there's no different information coming from different source. And with that toll free, where everyone can.
Yeah. Thank you so much. I do appreciate it. I'm just keeping tabs of the time, and I do want to make sure that we have enough time for some discussion and Q&A. So if you don't mind just staying on the call, and then maybe we can continue the conversation during the next segment, if that's okay.
Yeah, please. No, that was my last one.
Thank you.
Yeah, sure.
Over to you, Vidya.
Thank you, Hyacinth. And yes, we can also use the Q&A session to respond to some of the questions that have come in via the chat. So let me start with the first question to both DRC as well as to Rwanda, which is now that your sites are running, if you had to just reflect on the state of vaccine acceptance in your particular communities, would you say that given the low coverage rate, for instance, in DRC, for over 6 months now, would you say that it was a problem of vaccine hesitancy, or it was a problem of not having enough access options, or a combination of both? So just some reflections from you on that. So that's a question to the DRC team. And the slight modification to the question to Hyacinth is, how many people were you able to vaccinate at the site that you just shared with us about? And what do you think is the role of community acceptance when you think about how your site is operating? So first, the DRC team, and then Hyacinth. Was I on mute that whole time?
No, we could hear you.
Yeah.
Yeah, I could answer about the low coverage in DRC. So it's a combination. It's a combination of both hesitancy and also at some point lack of access. So as we mentioned, it began in April. So April was a time when well, DRC received the vaccines in March, and then just around the time that vaccination was supposed to start, there were some concerns about one of the main vaccines that the country received, the AstraZeneca vaccine, and so that had to be put on hold. Now, unfortunately, because of all the information that's being shared, both good and also all the misinformation that's been circulating on social media, that really affected the beginning of the vaccination when it was kick-started again in April. And then over time, we did begin to see an increase, but unfortunately, the vaccine that we had was very close to expiration date. And then at the time when the country did not have any more viable vaccine, that's when really people's perception started to change. And that was also in the middle of the third wave. So when people finally were able to were more accepting of the vaccine, we ran out. So once we got allotted the vaccine again, so we had to restart really that providing that information to the public of the vaccine being available, and then starting to sensitize them again of the various choices of vaccines that they have. So, and current surveys are showing an increase. I think we began from about 20% of people who are accepting of the vaccine to today, where we're at about 44%. So it's continuous work that's being done with support also from other partners who are doing a lot of the groundwork. And specifically for the site, what we're doing is using community health workers in the surrounding areas of the site to also do that interpersonal communication in order to at least try to convince people to get vaccinated and even referring them to the site.
Thanks, Carla. And over to Hyacinth about the question of what is the community's acceptance and interaction with the sites that you're running in Rwanda, and what are some of your reflections in general about vaccine, and whether having a site such as yours that you described is working, or there needs to be some other options as well?
Thanks for the question. Maybe just to clarify, my support is now at the central level, so we oversight several site across the country. So in terms of number, what we do every day, there's the out communication, the update to everyone, the status of the vaccination, the coverage, and all of that. I think as we speak today, we haven't had any where I would say we have an issue of lack of acceptance, because actually I would say we have an issue of supplies, because you see how the vaccine will not take more than a week at the central warehouse. And in terms of community acceptance and engagement, so the way the communication is, I think that's where the country have made a lot of effort. It's more before they hear any information from someone else. It's more the local leadership, the communicator ahead even before we push the vaccine to the facility level, and then they know clearly who's coming. In addition to the media communique. So and then so when people are coming, because the information is coming from the top leadership, it's not like we have different source of information. We've never had any pushback. Like I think for like any other country, it's not mean like you can have everyone vaccinated for a different reason. But I think there's a time like in Kigali where because that when the vaccine was still limited, they have to focus in the capital city, and they have reached more around like 100, because people from even outside of Kigali will come and be vaccinated in Kigali. So as now having that clear communication channel, so we haven't experienced any big hesitancy. I think it's more people thinking when I think the number of cases are reducing, I think that's where I might start anticipating that people joining I think the acceptance of vaccine might reduce, but it's more trying to take on that momentum and the campaign and the awareness that had been done when there was still that more cases, to make sure when the supplies are there, take on that before you lose that willingness of the community to take that one. So, so I'll pause there. Yeah, I'm not sure if I've answered both of your question.
No, you did. Thank you, Hyacinth. Another question to the DRC team is reflecting on the data that you shared, which showed such a large difference between the number of men getting vaccinated versus women. And so if there's any reflection on why there is such a large difference, and then if any knowledge and attitude studies were done in DRC, and I'd pose a similar question to Hyacinth as well, if you're seeing trends in the numbers of people you're vaccinating in terms of more of one getting vaccinated versus the other, or any other deep almost divides in terms of who is getting vaccinated. So first the DRC team, and then Hyacinth.
Yeah, I can take this one. My colleague Carla spoke about vaccine hesitancy, rumors, infodemia circulating around COVID-19 as an outbreak. Many people are still in denying about the existence of the disease, but also many people, they have so many misconceptions and myths around COVID vaccine that explain the low rate of immunization coverage. So among those rumors and myths and misconceptions, many women, based on some studies conducted by different partners around vaccine hesitancy, many women they raise concern about fertility or making the link between vaccine and pregnancy or breastfeeding. So there are so many rumors circulating and false information circulating around that explain the difference between men and women. So that's what is happening in the country. But efforts have been made to bring to correct the wrong information and those myths and infodemia circulating mainly on social media. Over.
Hyacinth, over to you.
Yeah, I think if you look, I'll be able to share like a link where everyone can see that live data. I think so far in any of the discussion we haven't any issue as saying people are no really that like a specific group is they are more hesitant to join the vaccination. And I think this comes when we start in a country where it's more cultural centered and people will tend to respect the older people, because we had that really high acceptance in among the older people. And you can even see when we start opening the booster dose, how many people really come on, because we start with those with the advanced age. So when you see your seniors, they are more into it. We didn't see any pushback. And I think with that of publishing the data in terms of who is affected by COVID, so everyone knows that they were at risk. So, and when the opportunities open to everyone, it was clearly like people really come to the vaccination site. And even recently, when they opened to 12 to 18 years children, you see that really we had that really high acceptance rate. And you see kids themselves going to talk to their parents that they need to come and provide consent for so they can get vaccinated. I think as we speak today, we haven't had any of that concern, and I think it will be too early to say because we still have that unlimited supply, if I may say so. If you reach the point where I've reached all the people, I think that's when you start seeing who's remaining, who's not coming, because we now know you have enough supply, but which are not moving. But now we have limited supply, means like we need to, if you open to everyone, so you know really see who's not coming. But at the moment, looking on how we are really taking up with numbers of coverage, it's really good. I will post the link here. It's something that we update every day, and it's really something that everyone can see and see that it's everyone who's really being covered by the campaign. Over.
Thank you. So we have about less than 10 minutes, and I see a lot of questions in the chat that really have to do with costs, whether it is in terms of how staff are paid, staff are recruited, as well as sustaining these activities. This is a big topic, and I definitely think we should have additional webinars in terms of how are we funding these sites and what are some strategies to use. Before I ask my question to my colleagues on the panel, I also want us to just sort of consider how these sites are not necessarily permanent structures that will become fixed posts or fixed health facilities for years and years and years. I don't think that's the intention. It is to quickly establish large volume sites which can respond to the community's demand for a certain moment during the vaccine delivery, and after which you do close down operations. How long that is, again, really depends on each country's demand and in terms of where they are at with vaccinating their target populations and the goals that they have for their vaccinations over the next year or so. So with that sort of level setting, a quick question to both of our two country representatives are around the staff. How are the staff being paid? Is it performance-based payment or fixed payment, and who is paying? Since 19% of the participants said that staffing is a big concern for them in running these sites. So Hyacinth, first to you, and then to Freddie.
I think I will start with your first point of this temporal site. As you mentioned, they are set up in a specific place where there are a big number of gathering. And that's pretty much mostly for the first dose. But when it comes to the second dose, people will not come exactly the same day. So they are directed to go to the nearest health facility, and then they can go into the existing channel of the immunization. They are not really, you can see like in the first time when there are quite a good number of temporal sites, but if you look now, most of them that have been closed. People are using the health facilities because the vaccination is taking place at the health center level. And in terms of personnel, see the same thing. The average first started with the existing immunization team at the health facility. And of course, as you mentioned, because everyone was against the time, additional nurses were hired. And the payment is the same thing as the normal, as the existing nurses are paid. They get the same contract as through the government, and they paid the same rate, the same salary. Although they are there for the campaign, and also in terms of the government adding more facility, I think from the plan is more, they also be joining other facility for longer term plan. But in some places where they need additional clinicians, they need to be they had to hire some of them to give a hand to the existing team at the facility.
Yeah, to echo on what Hyacinthe said, the same in DRC. We are not intending to keep those sites permanently. For example, the first site we established, we are hoping to keep it for 2 or 3 months and then move to another place. Kinshasa, I was saying, is a very big city. And so there is more need to have that kind of services in many places in Kinshasa. So we are hoping to move around in different places as long as it is possible. Regarding the payment of the staff, all the staff working at the site are government officials. We signed an MOU with the Ministry of Health to provide the staff and asked to pay them using the rate used for the campaign. So they are paid through us, directly into their bank account or through mobile money. So this is a very critical aspect because there's been a lot of concern around the campaign, not only for COVID, but other previous campaign, a vaccination campaign, around the incentives of the staff working at the site or running the campaign. So we are making sure that all the incentives are put in place using the flat rate, but for community health workers, we are motivating them also to be more active by reaching out the community members, knowing that they will be receiving their per diem at the end of the month, which is not always easy in other campaigns where the per diem does not come immediately after the campaign. It may take months before they receive the campaign, but now the incentive, they know they will receive their per diem every single month. So there is no concern about that. So that is a big incentive for community health workers, but also for all the workers, health workers working at the site. Thank you.
Thank you all. Over to Yvonne to wrap up.
Great, thank you, Vidya, and thanks everyone, to our presenters, our moderator, and especially our participants for a very informative and engaging discussion. We do plan to discuss and continue addressing this topic of funding in future webinars, as Vidya mentioned in the chat. So be sure to look out for more information on that. But in the meantime, feel free to continue the conversation in the chat box. So just a few steps to continue the conversation. So we do invite all our attendees to join the Boost community to learn more about our upcoming events, engage with your peers around topics relating to mass vaccination sites. We also invite you to visit the Ariadne Labs website to learn more about their work and resources available, especially work around the COVID-19 vaccine. Be sure to also join the Global Mass Vaccination Site Collaborative Learning Group on the Boost platform. Here you'll be able to get information on upcoming events, access resources, and additional tools relating to operations on mass vaccination sites. We would really love your feedback, and we would actually request that you fill out a brief survey so that we can kind of ensure that these sessions are as useful as possible. If you have any questions, feel free to reach out to us, either Ariadne Labs or Boost at info@boostcommunity.org. And with that, that concludes today's session. Again, thank you to everyone for joining us, and we look forward to seeing you on the platform. Hope you have a good rest of your day. Thank you.